Good evening, guys. Tonight we are happy to join you with another episode of Advocacy. Needless to say, we've been offline just talking about how crazy our week has been, but guess what? These are times that we need to come and give you our all. So um, you're getting the last of the last for today. But I think this, I'm just like, sometimes people don't know what goes on behind the scenes, but this is real life. We deal with real life just like everybody else. And so when we get on here, it's a commitment for us to come on and give you our best. Tonight, I think this is going to be a great show. We're talking about how we work with the teachers, the doctors, and all of the care providers to get our kids what they need. Sometimes it's forming relationships, sometimes it's being an advocate, maybe in not so nice of a way, or we try to be as nice as possible. But ultimately, the goal is to get our kids what they need. And I'll start off by saying, I've always been somewhat of a people's person. And once Morgan started going to school, of course, like most parents, I was clueless as to what this process looks like. So the thing that I decided to do was make friends, and that's what I did. I made friends with her occupational therapist, her physical therapist, her speech therapist. I mean, I just made friends with everybody. And my goal was to pick their brains, to try to get a better understanding of this process. Because again, I get that when I went to her meetings and when they had the infant and toddlers programs, they came in the house, they talked about the different things, but I still really did not have a full understanding because the first thing that I was trying to do is understand my daughter's conditions, which was she had multiple disabilities. So in addition to trying to navigate that process, then I was thrown into the school with not a manual as to what to expect, what to do.
Right.
So for me, ultimately, I started making friends. And some of those friendships I still have to this day. I also did it as much as possible. I did it when we went to the various specialists. Most of the specialists, I won't say that they were as friendly as the teachers were because sometimes when I went to take Morgan to the doctor and I would tell them what I saw, when you're talking to doctors that believe that they've gone to medical school and they've done their internships and they know the body inside and out, sometimes they get a little offended when you come to them and say, hey, let me tell you a little bit about my daughter. And
Yeah.
especially when it differed from what the book said. So
Hmm.
sometimes I had to change doctors because if I ever feel as though I'm not a vital part of the team, then you can't see my child.
And you
So
know
there
your
was
child best.
exactly. So I did bump into some doctors that were so awesome because as I was trying to pick their brain, they were picking mine because they wanted to know more about Morgan. They were curious. They wanted to understand her. They had a passion for trying to help me get what I needed for her.
Hmm.
So I will say for me, it was very helpful. Another thing that I did not do is wear my feelings on my sleeve. Sometimes when I bumped up into the doctors that could be, arrogant or ignorant in some ways, I did not just automatically cast them into the sea of forgetfulness. I was just like, okay, you know what? Let me give them another chance. Maybe they had a bad day. Sometimes that worked out, sometimes it didn't. But I will say that ultimately, I do have a great team of doctors now that listen to me, that want to understand Morgan. And so when I come in with a plan, sometimes my plan is not even the best plan. Sometimes it is. So one thing that I will say is to have a doctor or the educators that work in concert with the parents, because understand first and foremost, you are the expert when it comes to your
Hmm.
child.
Absolutely.
And when you have that confidence, I think that you can work with any specialist, and especially if you're coming in a friendly way. And most of them should be able to respect that. So that's been my stance on trying to work with the various specialists when it comes to Morgan.
That's pretty awesome. Now, the the team that Morgan has now, how long have you had that team in
Are you
place?
talking about the doctors?
Yeah, the doctors. Yeah.
I will say that she's been going to some of them since she was 16, a couple of them
Okay.
since she was 17. And I want to say that I really, really, really love this team because Morgan is 20 going on 21. She's kind of graduating from the pediatric side into the
Hmm.
adult side. So it's kind of funny because when we go to some of her appointments and we're going in there with people that are elderly, people that are in their 40s and 50s, Morgan kind of seems strange.
Hmm.
But I will say that she switched over to an adult neurologist recently. And when I say I went in there and it was a breath of fresh air. When I went in, it was like it was in January, I think it was. When I went in, they had a team of doctors and everybody had their thinking cap on. And of course, I came in with my thinking cap on. So the meeting, her appointment lasted for like an hour and a half to 2 hours. But what came out of that appointment is, hey, have you had this test done? Have you had that? And some of these tests that they were asking, she hasn't even had them done since she was born. And so they were like, no, we have we have all different types of testings, different methods now. And so they were like, listen, let's try to learn as much about her as we can. They were asking me different things and they were like, nah, we can find more information about her. So I'm excited because we're doing somewhat of a whole workup on her. And I'm excited to see the results because ultimately, I don't know if most people know, but Morgan has a rare genetic condition. And it's so rare, they don't know what to expect other than developmental delays. And
Hmm.
one of the more common genetic conditions is um, uh, what is it? Down syndrome. So,
Really?
yeah, that's one of the most common ones. If you notice that when you go get an amnio, a lot of them test for Down syndrome. So when I went through those tests and they was like, oh, the tests are negative, I'm like, woo! But
Yeah.
you don't realize that there are thousands of genetic disorders.
Wow.
Morgan's number 6 happens to be duplicated, but they can be tripled, quadrupled, it can be missing. So it's so many genetic disorders. Down syndrome is one of the most common ones. So anytime that there's a genetic disorder that's not Down syndrome, and they have some other ones that are common, but that's one of the ones I know of. They're going to really try to figure out what to expect from this child. I didn't find out anything other than developmental delays. So what
Okay.
they're going to do now is do another genetic testing and they're going to do it to see what Morgan is made up of. So
Hmm.
they're like, listen, we're excited to see what you may already know and then some things that you don't know. And so am I. I'm like,
Yeah.
okay, because it makes it so that you are better prepared to work with your child or understand your child because my goal with Morgan is to understand her as much as I can. Understanding her makes it so that I can be a better advocate for her and I can really work with her more if I understand her more.
Yeah.
So,
Especially as she grows and develops, things change.
exactly,
Yeah.
exactly.
So it's
So
it's
that's
yeah.
definitely my spill on it. And I will say, um, because I'm going to some of the doctors now and she's graduating from the pediatric side to the adult side, they're picking my brain. So they're having us meet in those meetings and they're like, okay, what about this? What about that? Some things I told them they didn't even know, or I didn't even know, such as Morgan likes long rides. Morgan could go on a 5 hour ride, and me and hubby laughed because it's not enough for her. They told me, you didn't know that some autistic individuals love to take long rides. I didn't know that.
And they don't
But
go to sleep. They look out the window.
and
Hmm.
Morgan looks out the window.
Yep.
She rarely goes to sleep in the car. If she goes to
Yep.
sleep, she has to be exhausted. But again, for me, no one ever told me that. That was something that I observed from her.
Hmm.
So some things that I observe is just like feeling my way in the dark. So it would be nice to have a team of doctors that can help you understand your individual as much as possible, especially if they're nonverbal. But even if they're
Yeah.
verbal, sometimes they may not be able to verbalize what's going on with them. So
Yeah.
that's my take on that. So
It's
Well, I
funny
don't
you
think
said
that
Oh, I'm
people.
sorry, Crystal.
Yeah, I don't think that people like you said, it will have to be something you observe. I don't think that
Yeah.
doctors can always tell you like there are a percentage of autistic individuals who might enjoy that, because the spectrum is so wide. It's so many, is really not too many pointers like it used to be. Like people say, do your kid does this, does that, those are markers. Well, those things may not be what your kid is doing. So sometimes it is, we're all learning the people that we're caring for. We're learning different things about them to see. But I do think that when we talked about building strong relationships, especially like with the academic setting and then the medical setting. And one of the things that I think it's important, but it's hard when you're in the thick of it, because if depending on what your child is dealing with in a medical setting, it's a lot of doctors, it's a lot of everybody in your ear, and it's hard to put together who is what. Sometimes, you might know the chief person, but if that's not the person you're constantly seeing, you're seeing someone else. And I'm not I live here in Michigan, and my local hospital is a university hospital, is a teaching hospital. So you can imagine sometimes when I take them to the doctor, there's a student in there, and there are times I was like, not today. I can't do it today. Like,
now some of the students out.
You're going to go tell the doctor, then the doctor's going to come in. I'm like, no, today I need to see my doctor. I know, I'm sorry. I want to cooperate. I do. Maybe on another kid on another day, not today. I had to have those moments because it can get very intense. And I didn't have a good experience with that one time concerning one of my kids. And so it can get like that. I don't know if it's right to do, but it was right for me at the moment. And then you're talking about on the education in the academic setting, a lot of times when your kid is needing more supports, now you're just not dealing with a teacher, a parent teacher. Now you have a team. And when you have that team, it can get confusing. I was like, because of the jargon, if your kid isn't already in occupational therapy, speech therapy, or physical, you'd be like, the OT, the social worker, the caseworker. Well, what's the difference? The this, the that, you can have, and it's not like they just like, oh, here's the list of all the people we're dealing with, and then if they do give you a list, it's like a list with contact information, and you're like, I don't know who to contact about what. And so it is important to, and it's kind of a skill to try to get those things together. Me personally, I just email the whole team, so we all in the know.
That's
so
right.
You don't have
That's
to
right.
be like, well, Miss Francis emailed me, and then the teacher don't have to forward it. Let me just put everybody on, the school psychologist, the caseworker, the social worker, everybody's on it, so that we can anyone who wants to chime in to respond, because we are a team. And I need them to know I'm part of this team and I'm included in every decision making.
That's right.
So that keeps that line of communication open. I think some parents are just still trying to find their way in that setting, in the academic setting. But the more it helps you, because also in the academic setting, it changes. What if the OT is no longer there?
Yeah.
Not all schools or districts are forthcoming in sharing that information. Yep. So you always have to be in the know. It should be, but you want to know, because you want to know, is your child's, your student's IEP being followed if they receive those services? So those are things and that's the part of that relationship you were saying, Paula, that you have to build. I need a relationship with my teacher. Like, you got to let me know what's going on. I can't advocate for my kid when I'm not in the know, and then you tell me later, and so much time has gone by. You know how it be like your kid failing, and you like, well, you telling me this, the semester is over.
Right.
This a couple of weeks ago when we about it, And so I think those are just some of the starting points for for just people who just trying to navigate their way, like what to do, where to go, and keeping those numbers and contact information of your doctors, your medical team as well. And it sometimes, to me, it helps. Like I always say, hey guys, I'm taking my kid to the doctor. I'm going to ask these questions. You gave me this report.
Yeah.
My doctor reads the IEP. Then my doctor be like, I need access to their records. I'd be like, hey, I need that form to sign because I want her to see all the records. And then she says, well, tell them do this, that, and the other. And then she said, well, give me their emails. I'd be like, oh, I appreciate that. And they respect that. They're like, oh, you're going to include your doctor too? Oh, that's helpful. You know, some teams. Yeah. Maybe not all teams are receptive to outside information, but you know, some teams may be, because it helps them understand your kid a little bit better. Right. So those are just some starting points that I was thinking about.
I love it.
Yeah, I was thinking about Paula, when you just said that Morgan likes to look out the window, or you know, she likes long rides. And we could never figure out why Grayson always looked out the window. He never went to sleep on these long trips. He never went to sleep, but I never really associated that with a possible autistic feature or characteristic or something. Because that's just funny that he does not go to sleep. He is wide awake. He's observant and looking out the window. But building these relationships with the teachers, the doctors, are so important when your child have disabilities, and being able to feel comfortable enough to share that with these professionals, because it's important that they understand who Grayson is. I know my daughter used to always say, Ma, you don't always have to say he's autistic. You know, if there was a different doctor that came in the room, I would greet her. He's autistic. He's nonverbal. I let them know before you approach him, this is where we are with him. He may not let you check his ears. He may not, you know, stick his tongue out. I wanted them to understand that. And I told her, I said, it's important that people understand how to approach your child when they have disabilities, regardless of what it is, just to give them a heads up. But once I did that and started to really communicate with his doctors, we built these relationships and an understanding that when I come in here and if I'm asking for a particular medication, this is what I want. He had a new doctor one time, and she said, I'm not going to give him that. I'm going to give him this. I said, no, this works better for him, because she kept giving me the whole scenario. Well, when we give this to other children, it works. In that moment, I had to make sure that she understood that we were talking about this particular kid, Grayson, and it does not work for him. Yeah. So being comfortable enough to let them know, no, this is the medication that I want. This is the cream that I want. This is what I want to happen. This is the test that I want. But that took time. That took growth to be able to speak up to these professionals who have these acronyms behind their name, who went to school and, you know, paid for their education. But I took time to study, and they have to understand, parents, we study these children. Yeah. They're with us all the time. Same with his teachers. It's important that we have relationships with the teachers. Our kiddos are with them all day, and to be respectful of them, to work with them. It's extremely important that I have good relationships with Grayson's IEP team, and that they understand the goals that I want for him, you know, his successes. I want to make sure that we apply obtainable goals that he can reach, and not what they think he should do. So it's in relationships with all these professionals that our kiddos need to work with are very important, very important. And as Grayson changes and grows, I need to make sure that they are changing and growing with him. One thing I do believe that I need to look into is a doctor that specializes in autism. Is that something that's of importance? Now, his doctor is familiar with autistic children. They do have some patients, but she did tell me one day that I should look into a specialist that for autism. Is that really?
I think that they call them developmental pediatricians.
Okay.
I want to say that that's some of the ones that they referred me to with Morgan. And
Okay.
I will say this is everybody's different.
Mhm.
Morgan and Jeremy has the same pediatrician that they've had from birth. They do. He is excellent. He does not specialize in autism. He doesn't. He's just a
Okay.
regular pediatrician. But they encouraged me one time. They was like, "Well, Paula, not him, but
Mhm.
some people was like, well, you may need to go to a developmental pediatrician." And I switched her there. And when I did, it was horrible. It was horrible for
Oh,
me.
wow. Okay.
For me. And I say this because these are my reasonings. If I call their pediatrician that they've had for years and I say I need to get in, I can get in 5 minutes.
That's
Her,
how
I'm
I am
going to
with
wait
his
2 weeks.
doctors. Mm.
Another thing, Morgan has had ear infections, chronic ear infections since she's been born. One thing that stood out to me is what you said. The first thing they want to do is give everybody amoxicillin.
Mhm.
Amoxicillin has
That's right.
never worked for
That's
her.
right.
So that doctor, their pediatrician, he says, Paula, what do you want? I'm like, oh, I want the Sefton family.
Mhm.
But when I went to her, it was a totally different situation where I had to, and she was nice, but her thing was, yeah, this is what we give. And these, like you said, this is the reasons why. And guess what? I took it, and guess what? I was right back at the doctor.
Yeah. Yeah.
So having a doctor for me that really listens to me and really gives me a chance to voice my opinion and respect that is more important to me than going to a developmental pediatrician, because another thing for me is he's Morgan's immediate pediatrician. When it comes to all of her specialists, she go to
Mhm.
other people. So it's
Yeah.
like
Yeah.
I even for referrals, when it was a time where we had to get referrals, to get a referral from him, all I had to do was call, bam, Paula.
Yeah.
The referral is, you can either pick it up or we'll email it to you.
Mhm.
This person, when I went to her, they had to put it in and they may give it to you in 2 weeks. To me, I was just like, this ain't gonna work for me. So
Yeah.
for me, everybody has their reasons for doing what they're doing. But when it comes to any type of specialty for Morgan, we go to a specialist. We don't go to him.
Yeah.
So he's just
I
the
was about to
basic.
say, why couldn't it just been a like for me, I do they do. My sons do see a developmental
Mhm.
behavioral pediatrician in addition to their general pediatrician. And
Oh,
so
okay.
she just was someone what happened was my doctor did notice, I went to her like, I know that my youngest need to be tested, but the waiting list, I was just overwhelmed. And she said, I already set up a date. And when she set up the date with this particular doctor, I got in, and this particular doctor also tested my other son. So then this doctor was like, Crystal, for sure your youngest is on the spectrum, but can I test your other son, Daniel, for the spectrum, because he did test for ADHD. And sure enough, I did. I agreed, because she just let me know, he was teeter-tottering. He was right there, but we saw
Mhm.
some things. So the thing is, I did not know this. I just thought that she would just be the tester. People go many
Yeah.
places and get their kid diagnosed, and then she has stuck with them. She started like, hey, how are things going? She would reach out, she would make a 6-month appointment. And so now we just have a stand-in, like every fall. We wait till school starts, we get going, and she wants to check in. Like, she wants to visibly see them, what's going on, how's the semester, how are behaviors, how is school, because then they're growing too,
Yeah.
they're and then spring she do another check-in, and she's like, well, how has things been going? And then we also communicate through our portal. Like, I think I sent her something saying, hey, the teacher sent me this long email about one of my kids, and I'm just like, should I be doing more? Is there something I'm missing? Is this normal? Because she's a developmental doctor, a
Mhm.
behavioral. Is this normal? Is this, it's not disruptive behaviors, but it also makes me think of, there are some kids who start, especially in those puberty years, can start like developing certain I don't want to really say, but I guess they're just diagnosed as some disorders like OCD and just certain disorders and stuff. They could be doing stuff repetitiously. And so I was just wondering, like, is this something like that? Is there something I can do? I'm not trying to make him normal. I'm just trying to understand his behavior.
He is normal. He's his normal.
You know, but I'm not trying to make him neurotypical. You know what I mean? I'm trying not to say, I don't want him doing this at all. But what I am trying to say, I need a better understanding. Is this something to be expected?
Yeah.
And then how? And I let the team know, like, hey, I appreciate y'all sending me this information. They gave me very detailed information, even from the school psychiatrist, psychologist. And I was like, well, you know, I'm going to forward this to his doctor, see what she said. And so she's not really, you know, so his doctor has been very instrumental. And that's when I was talking about those relationships on the medical side, how they can be helpful on the academic side. If you have a team that's willing to collaborate in that manner, it would really be helpful. So, I mean, maybe it don't hurt to have both, because I'm with Paula. When your kid has a cold, your general pediatrician, you know, knows your baby. The pediatrician has been seeing your baby all the time. But she works in pediatrics, so she kind of works on both ends. She's like, let me check his ears, because we did have his ears seen a couple of years ago. He had a huge wax buildup, you know, like, so she can do both. But we're really going to her. So, you know, I think it's like what Paula said. I would just look at it as a specialist, which is what they are, and keep them in addition. Like, don't be so quick to let the doctor go who's been watching your kid, you know, seeing your kid grow and all. Because every now and again I get a little call and it tickles me. I get a call and they'll say, well, your kid has not been seen by the doctor and you're requesting this, you know, one of my kids take a stimulant. You're requesting this prescription, like a refill. I always got to request it. And I was like, if you look at his chart, he done seen a behavioral doctor who done already, you know, and they be like, we are so sorry. You're so right. You're so right. You know, but they be like, we're not giving you this script because he hasn't come in. I'm like, well, he comes in for his yearly and if he's sick, but this, so, you know, I think that's, I think it wouldn't hurt. But it wouldn't hurt. But like Paul was saying, I wouldn't throw one away and just gain another.
Right. Because I really like his office. They are very responsive. They know him. I don't have any issues with them. It was just that one time when there was a new doctor, and the second time that we were in there, she gave me exactly what I wanted. So I don't have any issues, and I really love going there. I'm able to get a quick, you know, sick appointment. I just did not know when she mentioned that he should be seeing a specialist, because she was like, I don't specialize in autism. I'm like, but you're taking care of him. That's how she presented it to me. And because at the time I did not know that there was a particular doctor or specialist for autistic children. I didn't know that. I felt like he's sick. He has a cold. What is the difference from his cold versus someone else's cold? And then I would tell them that Grayson doesn't like medications that has a color. If there's a medication with no color, we'll take it. So, you know, I would just let them know his likes, but to, you know, present that she's not a doctor that specializes in autism, I was like, I didn't know that there was such a thing. So, but I'm keeping him there. They've been great. I just don't know. If she was to leave, then we may have some issues, but
because he was both of their doctors from day one, even Jeremy. I mean, and it's to the point, even for me taking her there, again, I was always skeptical of taking Morgan places that I didn't even feel comfortable. Like when Morgan get there, they be like, Morgan, get back here. She walks up and down the hall. You know, she's comfortable. They know her. They know her likes, her dislikes. And it's like they're very accommodating. And so that means a lot to me.
And that means a lot.
It does. It does. So for me, that's very important. And I will say, even as far as my urgent care people, I have a specific urgent care I go to that they know Morgan. They know her well. So even outside of her pediatrician, I'll go to them and I'll be like, you know, and they'll be like, wow, some of the people be like, we've seen Morgan before. I was like, yeah, get used to it, because I mean, for real, because for me, again, when I'm going to these doctors, and again, I say she's had chronic ear infections, Don't throw no amoxicillin in my face.
That's right. Grayson can't take
get
that.
into an argument with you. Like, this is not going to work. It's Kool-Aid to her for 10 days. You know, it doesn't make sense. And I will say, man, my husband went away the beginning of December, and her godmother and her brother had to take her to urgent care. They knew, just like I knew, don't give her amoxicillin. If you give her anything, don't give her. And I will say,
but is that like in her records or anything too?
No, it's not in her records. Jeremy was allergic. He's allergic. He broke out when he was an infant, like a rash all over his body. She's not allergic to it, but it has never worked for an ear infection. She has strep throat one time and it worked for her. But when they've ever given it to her for an ear infection, it's a joke. It doesn't work. And the Augmentin, it's a shame I know the antibiotics, but the Augmentin is in that family. It works for her, but when I say it gives her excessive diarrhea to the point that they have to create a paste for her behind. So in a sense, she's allergic to it. So I'm thinking that her and Jeremy can't deal with the amoxicillin families at all.
Yeah.
But I need people that's gonna listen. So when I was in New York, I was very pleasant. Her godmother was there, and she was like, "Yeah, I don't know. I think she's gonna give it to her." I said, "Okay, when she come back in the room, can you put her on speaker?" Put her phone on speaker. And I said, "How you doing, ma'am?" I said, "Listen, I'm gonna be honest with you. I gave her the whole spiel about Morgan, and she was like, well, I'm gonna just tell you. Sometimes they'll say this is viral, and I said, not understand that, but for her, viral turns into full blown. So whereas we all can keep taking medicine and it'll get better, her it does not happen.
Same with Grayson. Yeah.
And she says, so what do you want? I said, I want a Ceftin antibiotic. I said, none of the other ones work for her. So she went down. She said, okay, we have this, blah, blah. I said, that works. I said, you know what? I truly appreciate it. She wasn't the happiest at first, but my approach to her, I was like, I really appreciate it. I said, because some people don't like to listen. And I'm not trying to tell you your job. I just know what works for my daughter.
Absolutely. I think that's so important. I'm willing to listen to you. You know, I'm willing to let you get it all out.
Yeah.
And then I'm going to say, I understand that, but that's not exactly what works for my kids, you know, because I'm going to listen to you, and because you might be saying something I did not consider.
Exactly.
So I don't want to exclude that. But I also know, you know, we know for our kids what work and what don't work. And I try to include a lot of that in their records. Like when I look on their portals and stuff, like, please put that, you know, my husband tells me that, like, you know, when you're advocating for even yourself, and he's like, he was sharing how he went to the doctor and the doctor didn't want to, you know, give him a referral. And he said, I tell you what, put that in your notes that this is the second time I asked and you said no. And the doctor was like, well, let me write you a referral.
Right.
I mean, because now, you know, he's like, I'm telling you my family history. I'm telling you things that are going on, and I would like this tested. And so I just feel like in that case, that's how we should be concerning ourselves as well as the people we're caring for. You know, we'll put that in your notes. You know, that's important. While she may not have an allergic reaction to it, it is just something that just doesn't work. Maybe her system is just really used to it, is non-effective, whatever the case. Can we put that in her notes? Because this is coming up too frequently. And
I think that they're reading the notes, Crystal. That's an issue. They're not reading the notes.
Well, I know her doctors do read it.
I don't have a problem letting you know it's in the notes, because I go on the portal and I see the notes after the visits and everything. I see all that information. I have no problem emailing back saying this is missing, or, you know, things like that. And for the most part, they're pretty detailed in where I'm located here in Michigan, how that information can come about, where my kids have been going. But, you know, I feel like as we're advocating for our individuals in our home who we're caring for, our loved ones, I also know, like, they're growing. Like Paul, you just said now that your daughter has to see, she's moved out of pediatric into like adult care. And so my one of my daughters had a heart issue. So she had a heart murmur, a hole in her heart, and she had it fixed. And so now she needs to be seen by, you know, a cardiologist, not a pediatric. And so what I loved about it, that they were letting her know they were handing her off into better care, because while she's now the oldest in pediatrics, she will be like one of the younger patients going into an adult cardiologist's office, and that can be intimidating. And then they need their patients to keep going for their visits. And they said they worked up a system to help them transition better. And I was like, that's impressive.
That was nice.
That was nice, because I'm also teaching her to take her care in her hand, you know. So, but then on my daughter, my oldest daughter, we know she has cerebral palsy and she has just other challenges. When it is time for her to move out of seeing the pediatrician into an adult doctor, you know, I really appreciated that her doctor was like, Crystal, this is the type of doctor we want her to see. We want her to see someone who cares for individuals with disabilities, who listen. When I tell you her doctor listen, first of all, her doctor probably upset at her right now. You know, she's not upset, but she's like, Ja, girl, I need you to gain some weight. Don't play with me. I need to see you back in 3 months. Because
that's a good problem to have.
Yes.
It's kind of good, but health-wise, you know, it's not. I don't want to say it's kind of good. It's unfortunate. It is very challenging.
It is.
To help her gain weight. We've been working at this for over a year, but because the doctor and I have developed this relationship, and, you know, I always tell Paula, I'm doing supported decision making. I'm sitting there like, well, how do you feel about that? Do you want a flu shot? It's up to you. You can ask for information. We could go home and talk about it. But if you have questions right now, she's here, and she never rushes her. She says, do you have any questions? And she sits, and it's quiet.
I love it. I love it.
And I like that you acknowledge her. Yeah.
He acknowledges her. Yeah. And then John looks to me and be like, Mom. I'm like, Ja, girl, this your body. I go see my own doctor. You know, I need her because I put it back on her. Yeah. But I'm like, I'm here to support you. I'm here right here. Do you want me, you know, to ask something? Or when she's asking, I say, are you asking this? Because her speech can be unintelligible. So I'm saying, are you asking this? So she's like, yes. And I'll say that. So she's in the nice and really good hands. And I know this doctor cares because she's very much concerned about, you know, her being able to gain weight and to have the energy that she needs because she participates in Special Olympics, and then just to live life, you know, and that's that good relationship that you want. She's like, you know, at one time she's like, I need her to step on the scale. Girl, send it to me through the portal. You know, just give me weekly updates, you know, but she lets Jael know that she cares about her.
I love it.
And John needs to gain weight. Grayson needs to lose weight.
Look,
Morgan used to have to gain weight, but now that I be putting on Morgan stuff, I be like, Morgan, me and hubby have cut back her portions because I don't know. And I said, getting her out on that bike, it's not optional anymore.
Right.
Yeah, so it's funny because Morgan and Ja was in the same thing. Hubby be like, them jeans is kicking in. Yeah. She jumped from like a kid 14 to now she's in 3/4s. I'm like, Morgan.
Oh wow, Morgan.
Yeah. She's growing up. Speaking about weight, that takes me back to even food. The food items that they have to eat, whether in school or wherever, and I have to let the teachers know, Grayson doesn't like that. He likes this. He's got a lot of food sensitivity. So not only are we advocating for the medical, for the education, we're also advocating lunchtime. You know, what's on the menu? What should he eat? What snacks should he not have? It's a lot that goes into play when you're advocating for, you know, your loved ones when they have any form of disability. It's a lot. All these sensitivities that they have, taken the shoes off, socks. There's so many sensitivities that our children have that we've got to advocate for every part of them. And that it's challenging, but we've got to do it. It's like a part-time job for us. That's what I always say. It's a part-time job.
Yeah.
It is. I think I liken it to how I communicate. I like to, keep in touch, send a text, send whatever. So I do that with teachers. I do that with, if my kid has a one-on-one. I used to like that because you're right there with my kid. So if you're right there assisting my kid, I used to be like, you can have my number because,
text me.
They cutting up. You do know you have to don't disrupt the class and ask the teacher. You do know you could text me or you could pull him to the side in the hallway and call me because he just might need to hear my voice.
Yeah.
And they would laugh and it will work, but I'm here to help that the day move along because sometimes I think we all, certain behaviors can interrupt what they're trying to learn. Whatever it is, it's not like behaviors are negative. It just could be anything that our kids,
it's how they communicate.
It's how they're communicating, but it affects them in an academic setting when they're trying to just trying to get them to learn anything. Let's say tying their shoes. You thinking, it's hard to get them to do it because they're just doing something else. They're taking off their shoes all the time or something like that. And so sometimes you're like, let's get to the root of this. Oh, you know what? Sorry, I've been there, guys. Be like, oh, I guess that foot grew. No wonder.
And the shoes too tight.
The shoes too tight. No wonder.
Something as practical as I have outgrown my shoes.
As small as that, we up here thinking, why does kid keep kicking off their shoes and we can't teach them to tie, or they learn to tie with it off, and they was like, well, let's teach how to tie with it on. No, they don't want to tie with it on. Them shoes too tight. It's simple, and then now we can move on. Now we discovered what the issue is. Sometimes it's that simple. Sometimes it's not, but sometimes it is. And so that's why I love that constant communication, because how would I know if the teacher or the assistant or whoever never said, hey, we've been trying to work with this kid with this, but this is going on. I want to know what's going on. I don't want to know at IEP. That's not the time.
It's too late.
No, it's too late. I want to know along the way. I'm always one of the people. I'm one of the people who want to know. So I have Daniel in high school, and I reached out to the teacher, and I'm like, hey, I'm here to help my kid. This is a challenging class. English is a bit challenging, with comprehension. He's a concrete thinker. It's very black and white with him. But I can't help him if you don't tell me.
Right.
If you don't tell me early on how I can get in and get his academic team, his achievement team, get his casework involved, get him in tutoring, get him in whatever helps he needs so we can get there. Because if you tell me too late and then he's not doing well in the class, like, how can we recover?
Right.
So let's help him be the most successful student he can be. And it's communication. I went right to the school, talked to the teacher like, hey, I know we just changed semesters. He's new in your class. But I'm that parent. I'm here to help.
I know. Listen, you that parent. And that's what we all have to be. We have to be that parent. And let me say this, even in our communicating with these the health professionals or the educators, we need to be respectful. And I know that we are respectful, but there are a lot of parents out there that approach these educators or the health professionals in such a nasty and negative way. And we expect for them to treat our, children, with respect and dignity because they have a disability, but we still have to approach them with respect. And I try to always do that. I'm dealing with an issue now with transportation, but I still approach them with respect. I still show my care, and I'm kind to them because they have gracing for 2 hours on the bus. So, you've got to be kind to those that you're asking to take care of. And a nonverbal autistic child that cannot tell you that something's happened. So we kind of got to trust that they will do the right thing, be respectful, let them know, your expectations. I let them know what my expectations are, and I'm respectful with that. And the same for the school. show respect and be kind and give them a treat every now and then. Drop them a note, a thank you note. Drop them something every now and then to let them know you appreciate them. You appreciate them taking time for understanding, for working through all of these behavior issues and providing that emotional support that some of our children need. I let them teachers know that.
That's important.
Yeah.
And I'm gonna say this, even with Jeremy, when Jeremy was in school and I was that parent. I was always in that teacher's face. I was emailing that teacher. I was volunteering up to school. I was always around. And one thing that I will say is I got the same response from Jeremy's teachers that I get from Morgan. They were like, we wish there were more parents like you.
Yeah.
Even when it was, I'm like you, Bunny, even when it was a negative situation, I tried to approach that thing as nice as possible. And I had to check myself sometime, because I will say sometimes when Morgan was younger and I had so much going on, I was so overwhelmed. That's something I wouldn't have ordinarily gotten upset about at the doctor. It was like I was upset about it that day. And so a lot of the times what I did was I prayed before I went to her appointments, and I always checked my behavior, because I'm like, today she kept me up all night, or she was sick. So Paula, you gotta be extra nice, because a lot of this is you today. It ain't nobody else. And so I always practice that. And even with the school, I look at Morgan's bus, her transportation, everybody at her school, her doctors. I look at us as a team, trying to do the best that we can for Morgan.
Absolutely.
And I will say, honestly, at this point, I have a great team of people. Even today she was sick. Her bus driver and all of them is checking on her. And I'm like, she's not going to go today. And they always say, we just love the fact that you keep her home when she's sick. Do I want to? Cut to the no.
Right.
But, it's just
all parents need to keep them babies home.
Yeah, but for me, it's like I think about me. I think about her. I know if I'm sick, the last thing I want to do is go out in the elements.
Yeah,
and
it's already cold.
Now I'm subjecting her to the elements, and then she's nasty to everybody all day. So for me, it's all of these things for me play into me being respectful of her school, being respectful of the bus drivers, being respectful of her students, her fellow students, because I don't know about anybody else's kid, but when Morgan is sick, she ain't putting no mask on. She ain't putting it on when she's healthy. So if I send her in, that's basically saying I don't care anything about them. And all of those things, teachers and the bus driver, they take that stuff into consideration.
So, and they will in turn appreciate you.
Yeah.
Oh, they do.
And they will make sure that Morgan is taken care of.
And they do.
And sometimes Morgan gets extra favor.
She does.
Because they know that, first of all, you that mama.
Yes.
And they will take care of Morgan because of the type of person and parent that you are, a caring parent. Yeah.
And I will say again, I'm not saying that everybody is, everybody in the school system is there to give you the best that they got. I'm not saying that. The healthcare, sometimes you could go and people could be nasty. But again, for me, I just look at it just in every aspect of life. I'm going to turn that frown that they have into a smile. That's my job. So I'm not going to go in there and give them what they give me. And I will say, in most cases, these people remember us based off of how they be like, I remember you.
Your interaction with them.
So that's right. And they always be like, you dress her so nice and y'all always so friendly. That's what I want to hear. That's what I want to portray.
Absolutely.
And for me, I do that with her school. There are times for Christmas, I don't just send lunch up there for her teachers, and them teachers can say, I will order food for the entire school. Because for me, again, I want them to understand that I appreciate them. And I'm just like, if nobody else says they appreciate y'all, I do, because I got one Morgan. You all got
many children.
That's
right. Yep. I agree. I ordered lunch for Fridays. I ordered, I sent money to the teacher to order food. So it's important that we show that appreciation.
Absolutely.
And I often think when you say we have to go in these places and not match energy. If their energy is off, we don't want to match their energy. And I often think if I'm cutting up, acting I'm out of character because I woke up late, now I'm rushing, or whatever the case may be, and I'm in church praising the Lord, and this person is visiting my church, and it's like I often think about that. It's like, but you got to watch yourself, and that's important. That if we are upset because of something that we've done or something that Grayson has made me mad, I can't take that out on his teachers, the bus driver, the doctors, or anybody else, because I wasn't able to handle the situation, because I never want to be out of character to the point that I see somebody in the store or I need that person to do something for me, and their last interaction with me was so negative that it would hurt a relationship, building a good, solid, professional relationship with me based off of that. So I try to keep that in mind, even in dealing with Grayson and all of these professionals in his life, his whole medical team, the school team. I've got to watch how I approach them. Now, I'm upset, but I can use that differently. I can just make sure that my tone is firm. So there's ways that I've had to learn how to deal with things when I found that I felt that Grayson did not get the best treatment.
Right.
I did not go into these meetings being nice as his advocate and caregiver, but I was firm with my tone. I let them know that, through the tone, that this isn't okay with me, but I still was professional. So that's one thing I had to learn. I had to learn to watch my face, not to roll my eyes, not to, those are things that I had to learn how to deal with them, because when you're on one side of the table and you've got the entire team on the other side, they're all looking at you. So you, as a caregiver, in trying to build relationships, we have to learn how to use our voice, facial expressions, gestures, everything in more of a positive way, but letting them know that we are those mamas.
Yeah, I'm being honest. Sometimes it can be a situation that takes you there. And it sometimes, I've had those moments, and I know that, they may not have seen me in that light.
Yeah.
But I honestly, I had to, sometimes you're getting phone calls, and it's like, you just need to come get your kid. Like my kid is, and I think that, those were those moments like, I'm probably going to take my time and come get them. Because I was literally thinking like, let me go home first, let me change my clothes. Just pull myself together more. I don't want to look like I was at the gym. Let me just pull myself together more. Honestly, I was like, let me go pray. And then let me call some people I need to pray for me.
Yeah.
Because I think sometimes you're pushed to that limit, and I think we all have those moments, that limit. And it's just like, enough is enough. And you really feel like the support is not there. And, and then I was able to walk in and do exactly what you said, Bunny, be able to articulate, be firm, but had I reacted initially, I think they'd have been like, was that Miss Francis?
Right.
I never seen Miss Francis upset like that, And then there were times I had to call my husband and say, look, I think you need to take off. I think you need to show up to this meeting. It's detrimental, because they see me. And I said, I need them to see that there is a very involved father.
That's right.
There's a very involved father. Yeah. And, sometimes when he would talk, I'd be like, oh, he asking the wrong questions. I need him to be quiet, But then there are times that
I need you to be there. I need your presence to be there, but I need you.
Right.
Because you asking questions. We done already talked about that the last meeting. That's why we here. You know, like you asking the wrong questions. But you know, it's just like I'm with you. I need his presence there.
Yeah.
And then I'm like trying to brief him, like this is what's going on, and this is not looking good. But I think that your presence there, because I think people are less likely to talk sideways to me.
Yeah.
Or to say something like they're trying to appease me.
Yeah.
And that's, you know, and so, you know, because I you know, you don't want to be out of character, and you don't want to act on your emotions.
Yeah.
I know I don't. I won't want to act on my emotions.
It definitely can be emotional.
Definitely.
It is. I'm in my feelings.
Oh, I've had some moments, and just a couple of weeks ago, on a IUP call, I had to lean in. I leaned in to the camera. I leaned in, and sometimes you have to do that, but not step outside of character. But you know, you've got to lean in because, like you said, Crystal, they try to pacify you. They try to say these words and use these you know, examples and put your kid in this box. And I'm no, not Grayson, not that one, not that one. He won't be in that situation. So I had to lean in, and I had to be extremely firm, and I had to raise my voice. And I just told them, you know, understand where I'm coming from. This right here struck a nerve. I let them know. So I think that kind of puts the team on high alert that, first of all, she's that mama. Second of all, don't try that with Grayson.
Don't cross that line.
Don't cross that line. Exactly. You know, we've still got to set the standard and set the bar or whatever, and set boundaries on. You're not going to do this to this kid, which you shouldn't be doing it to any kid, but especially because I'm his advocate, you're not going to do that. So
absolutely.
There are times I have to lean in. There are some times.
I'm serious. I think this was an excellent topic. I mean, and I think we can go on and on because I had some things that came up in my head. I know it'll come out at another meeting. I mean, at another podcast. I love what Gwen said, and I love what Joy said about you being advocates for your child. And I don't know, for me, I'm dumb enough to believe that I can change those people that want to push them kids in the corner. I don't know. I've always been, Jeremy be like, Mom, you are so funny. Because even when I would go to his lunch duties and I would see the kids, he was like, Mom, you always talking to everybody. I said, because I want everybody to know that I'm that one, that I'm going to take the nicest role. I'm going to take when I go there, which I don't try to do that often, they're going to know that was her last resort. She tried to warn you. She tried to give you the sweet sugar, you know, but there are times that I will say that I think that's just inevitable. Sometimes we have to go there. And I will say, for me, there are several ways that I can go there. One, I could take and be silent. But Jeremy said, Mom, it's all in your face. So I can be, if I know that my mouth is not ready for that day, I hold my tongue. I hold my speech. But a lot of the times when I come back, I've never had to come out and say what I wanted to say because they saw it in my face. And there are other times that I just have to be quiet. So I will say that I kind of let the Lord lead me on how to do it, because like you say, Crystal, some days I'd be like, oh, when I go in there, I'm gonna say this. And then when I drive around a little while, and then I take, like you say, I'll call people and be like, talk me off of that ledge because I'm ready to jump. And I was just like, you know, so for me, it's just like recognition of me is the first. That's right. Is that first thing I have to do. I have to recognize where I am, who I am, so that I won't go and do something that I would regret later. So that's
why I asked y'all for prayer. That's why I said that. I was like, pray for me, because I had to lean in, but I knew that I needed some prayer.
I get it, honey. Absolutely.
Yes, I will say, for me, you know, parents, get out there, get to know your kids' teams in the healthcare,
so that you care
in your neighborhood. As Brown on the Spectrum say, and I just love that. I'm gonna keep saying that. Get out, get out,
get outside,
get out there and get involved in your kids' everything, because I'm telling you, you're going to need to do that to navigate this thing, because
right.
you're your child. Most of the time, even if your child is verbal, I know with Jeremy, I was still his voice for a lot of
That's
things
right.
until he
That's
got up
right.
and said, Mom, I got this. He still got to tell me to this day, Mom, I got it. So I will say, you know, get out there, be an advocate for your child, know your child,
Yes.
understand your child, so that when you go to these doctor's appointments and you go to these IEPs, or you go into school, that you can properly advocate for them. And it doesn't have to be where you're going in there throwing up your guards ready to fight and cut somebody out. That ain't
Right.
gonna get you nowhere. It's
No,
not.
and it's not going to get your child anywhere.
No,
That's the
no.
same thing if you're in the hospital and your family is coming in fussing with the doctors.
Yeah.
You're the one that's got to stay there in the bed and get care. So
Yeah.
that's why I always, even when taking care of my mom, I never would go in the hospital and be nasty. I always had to really humble myself all the way down and just try to be nice so that she can get care. It's the same thing with our children. We can't
That's right.
expect to send them somewhere and expect for them to get cared for. And I love that Gwen is on. Gwen is a retired special education teacher.
Yeah.
So I'm sure she can relate to a lot of this that we're saying with her being a teacher, seeing or not seeing the support from parents.
Mm-hmm. Yeah. So Crystal, did you want to say something for us as we're going out? Because y'all, I ain't gonna lie, this is a great subject.
Yeah.
This is a great subject. So
I think
done.
In building those relationships, I think it's important to let both sides know what's going on. I be telling the doctors, this is what they doing at the school. And I tell the school, this is what the doctor said. The doctor increased his medicine. So if he falling asleep, let me know this, that. Like, I try to let both sides,
Right.
I try to keep that communication very open. I let both sides know what's going on, because how can I get the optimal care I need for this particular kid if the doctor be like, you never even told me, or the teacher be like, well, how was I to know? So that's what I try to do. I really keep that communication open with the teams on both sides. And I would just encourage parents who are caring for individuals with disabilities in an academic setting, when you're medical professionals, just keep it open, build those strong relationships, get to know them, and collaborate on both sides.
Yep.
All right, guys. Oh my gosh, this has
been great.
subject.
Even good comments in the comments. These are really good comments as well.
Yes. So we thank you guys for joining us for another episode of Advocacy. We will be back next Thursday, and we appreciate you joining us next Thursday. Everybody have a great weekend and bundle up, because it's cold outside.
Yes. Cold.
Sure is.
All right. Wait, everybody have a good one.
Bye.